The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. My name is Karen Odegaard, and I am a community coach with the County Health Rankings and Roadmaps program. My colleague, Kate Conkle, is also here, and you'll hear from her in just a few minutes. We'd like to welcome you to our informational webinar on the Roadmaps to Health coaching program for teams. This program is designed to provide specific guidance and tools focused on your community health improvement goals. The Roadmaps to Health coaching program for teams is for communities that have completed some type of health assessment, set priorities, and are now ready to take action. Today we'll learn more about the opportunity and whether it's right for your community. We want to take a moment to get you oriented to the technology that we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, on which you'll see our screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. We will be taking questions via the control panel, so please feel free to enter your questions in that panel at any time, and we will answer them toward the end of the webinar. Here's a quick outline of today's webinar. We'll start with a bit about the context for coaching and then talk more specifically about our coaching opportunity. We'll discuss how and when to apply and highlight some key dates. And then, as always, we'll leave time for your questions.
So I'm going to start by walking through the foundation of the County Health Rankings and Roadmaps and how this will frame the Roadmaps to Health coaching program for teams. I know that this will be a review for some of our loyal followers, but hopefully a good refresher as well. So the model that you're looking at underpins the County Health Rankings. Starting from the bottom, we believe that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes to show how healthy each county is, how long people live, and how healthy people feel. When communities assess their needs and resources, they often start at the top of this model, the health factors and the health outcomes, looking at how long people live and how healthy people feel, and then digging deeper to understand the health factors that influence those outcomes. Understanding your community's strengths and challenges will help you take action through policies and programs that build on your strengths and address your challenges to improve health. This is where the County Health Roadmaps come in. Roadmaps show us what we can do to create healthier places to live, learn, work, and play. Roadmaps help communities take action. And this is also really where the Roadmaps to Health coaching program for teams will focus. And more on that in a bit. But first, let's explore a little bit more the County Health Roadmaps. There are 5 core principles that are the foundation of the County Health Roadmaps. First, it takes everyone, all of us working together to improve the health of a community. We need to move as quickly as possible to the left side of the wheel, not get stuck in the paralysis by analysis or drowning in data, but moving to action and evaluating your effectiveness. This will hopefully make more sense in a minute when we take a deeper look at the Take Action cycle for those of you who might not be as familiar with it. Also, we don't need to reinvent the wheel, and we should be looking to the evidence to inform our action. And if not, we innovate, but be sure to evaluate your work. We want to keep focused across the health factors, including social and economic factors. And finally, don't be afraid to take on policy systems and environmental change, which will in the long run create the greatest long-term change in health for the children and adults in your community. This is the County Health Roadmaps homepage. From here you can find a variety of tools and guidance to assist communities in the Action Center as well as in the What Works for Health, a database of more than 250 evidence-informed policies and programs to choose from. For many communities, the tools and guidance available in the Action Center is just what they need to move forward, to move their efforts along, or help them overcome an obstacle. Some communities, though, we know are looking for help finding the right tool or thinking through a first or a next step in their efforts. And this is where community coaches can help. Community coaches are available to consult with you about how to best move action forward in your community. This may just be an email or a phone call or two, or as Karen will tell you about more in a bit, it may be a longer-term process. And the work that we do with communities is framed in part by the Take Action cycle and really helping communities move through it, and particularly, as I mentioned earlier, to the left side of the wheel. So let's take a look at what I mean by that. The Take Action cycle is the how within County Health Roadmaps. At its core are people working together, because we know that solving issues like poor high school graduation rates, excessive drinking, or inadequate health care require the wisdom and resources of people from all walks of life. So first we gather information, we set priorities, we try to find the most effective approaches to address those priorities, and then we do it. And of course we want to evaluate throughout the cycle to make sure what we're doing is working and to improve your strategies and ensure effectiveness. You'll also see that communicate sits in the center of the cycle as well. That's because communication with stakeholders is essential throughout the Take Action cycle. We work with communities across the stages of the cycle, but the coaching opportunity that we are talking about today will really focus on the inside, so work together and communicate, and the left side, starting with choosing effective strategies through implementing and evaluating them. Now that we've walked through the foundation for the County Health Rankings and Roadmaps, let's talk about the concept of coaching and what the community coaches can offer to your community. Many of you have probably had a coach or maybe even been a coach at some point in your life, maybe on a sports team in school or a forensics team. So think about the role that the coach played. He or she was there to inspire. We've probably all seen the YouTube videos of the motivational speech in the locker room before the big game if we haven't been part of one ourselves. Coaches can help others to see their own potential and see what is possible. Coaches also come up with a game plan. They can't be on the field to execute it, but they can help a team come up with the best strategy based on the strengths and weaknesses of the team members and based on the strengths and weaknesses of the opponent. But the team has to execute the strategy or the play, be it a full court press or passing a local policy to support early childhood education. Coaches also play the role of skill builder. Again, since coaches can't be the ones to execute the strategy, it's important that they build the skills of the team to be able to get the work done. Coaching is much more about building capacity and giving people the tools to do the work and not doing the work for them. Coaches carry out these various roles by wearing different hats. Sometimes they are facilitator, sometimes subject matter expert, and sometimes they are in the role of learning coach. As a facilitator, coaches will act to move the team towards accomplishing a task, keep the team focused and moving forward. Sometimes coaches are subject matter experts. They will provide specific technical or contextual information that will help the team move forward or overcome a barrier. Finally, in the role of learning coach, the intention is really to increase the capacity of the team to self-manage, to draw from their own learning and own experiences to find the solution, or be able to learn from the struggle and the mistakes that sometimes happen when doing the work, at times messy and difficult work. Coaches strive to be thoughtful about when and how to intervene. Sometimes they need to call the timeout to give the team a chance to calm down or take a quick breather or get some water and regroup. Sometimes they need to call the timeout to draw up a play or provide some insight that they see from the sidelines. And sometimes they just need to sit back, observe, and let the team work things out on their own and build capacity to get through a sticky situation, looking to the on-court or on-the-field leadership to make a decision. This is how we think about our coaching. When we are helping to advance your work, not by telling you how to do it, but by observing what you already do and helping you find the right tools, skills, and strategies to keep you moving forward in an effective way. So Karen is now going to tell you more about the Roadmaps to Health coaching program for teams and how you can apply for it, if it seems like a good fit for your community.
Thanks, Kate. The Roadmaps to Health coaching program links community coaches from the County Health Rankings and Roadmaps program with a team from your community to provide specific guidance and tools focused on your community health improvement goals. So we will be using an application process to select up to 12 community teams. Coaches and teams will work together over a 9-month period following a mutually designed plan of action to identify the most effective tools and activities related to the community's goals. Our work together will be focused on your community's unique needs, but will still remain flexible enough to respond to new opportunities and challenges that may arise. We are able to provide this service to successful applicants thanks to the Robert Wood Johnson Foundation. Every community has a unique way of bringing people together to work on health issues, ranging from informal groups of leaders to voluntary coalitions to formal alliances. We refer to any such group as your partnership. So this coaching program is designed for a representative team of 4 to 5 members of that type of a partnership. We are looking for teams to represent partnerships with active engagement from community members, including members of vulnerable populations. Partnerships that conduct community health assessments and set goals and priorities with their community members. Partnerships that rely on data and evidence to choose their health focus area and to plan action. And perhaps most importantly, partnerships that are ready to take action. So again, these teams of 4 to 5 will represent this type of a larger community partnership. We are looking for teams with members who represent the breadth of partnership, meaning they come from different types of interested organizations, fields, or sectors that are stakeholders in the problem that the partnership is aiming to address. We will look for teams that can clearly articulate how their participation in the coaching program will impact their ability to improve health in their community. Together, teams and coaches could work on a variety of things, including strengthening an existing partnership to take action, selecting and implementing a policy or a program to address a specific problem that your community has identified, creating an evaluation plan for that work, or something else where your partnership can benefit from an expert guide with tools to help you navigate through the process. The coaching process focuses on achieving goals co-developed by your team and the community coach. These goals will be based on your community's needs and the specific content that our program, the Roadmaps to Health coaching program, has to offer. Coaching will include up to 8 60 to 90-minute team coaching calls over a 9-month period, as well as an optional community visit. Teams will commit to work between coaching sessions and identify goals for a community visit if that option is chosen. Participating community teams can expect to build their capacity to do one or more of the following. Work together to impact health. Again, thinking about the center part of the circle that Kate was talking about with our Take Action cycle. Choose and implement effective policies and programs that can impact health. Evaluate health improvement efforts. And choose and use the right tools at the right time. Applications are available to be downloaded from our website. You can find them on the County Health Roadmaps landing page at countyhealthrankings.org/roadmaps. We're also going to be chatting out a link to the application now. You'll want to complete the application as well as a team roster. So the application will include a link directly to a team roster that you can also download. So again, it's a two-part piece. It's a two-part application with the application and then the team roster. The application and team roster will ask about 20 questions altogether. You'll find questions about your community as well as several questions about the partnership and the team. We also ask about the problem on which your partnership is focusing. We encourage you to define your focus area as narrowly as you can. Doing so will help us provide more specific guidance to your team. The team roster asks for each of the 4 to 5 members of your team to answer a few questions about their contributions to the team and what they hope to gain by participating in the program. Each team member should complete their own form. And then as a team, you'll submit one complete application. So let's talk about submitting these applications. You'll see on the screen here a naming format for how applications and team rosters should be saved. So we're looking for you to save these documents with the community name, and then a period, your state abbreviation, and then another period, and then application or roster, depending on which document you're working on. These materials will then be emailed to us at match-info@match.wisc.edu. That email you'll see there. And that email is also listed right on your application, so you can review it there. Applications are due by 4 p.m. Eastern Time on Tuesday, November 12th. Once we receive your application, we will let you know that we've received it. So if you don't hear from us within about 72 hours of submitting, please do check back to make sure that we received your application. So just to recap a few key dates here. Again, applications are going to be due at 4 p.m. Eastern Time on Tuesday, November 12th. We will be notifying applicants of our decisions on Monday, December 16th. Each successful team will be linked with a coach who will contact them in December, and then coaching will begin in January and run through September. We have 3 community coaches that will be working with communities: Kate Conkle, who you heard from earlier, myself, and our colleague Jan O'Neill. We are all very excited to be launching this new program. If you are not quite ready for team coaching, or maybe you just have a question about a tool or guidance, you can absolutely still reach us. Throughout our website, you'll find large orange boxes with the question, "Need help?" You can click the contact us in that box and let us know how we can help. We want to encourage you to still reach out to us if we can be of help to you in ways beyond this team coaching package. We wanted to make sure that we left plenty of time for your questions about this, this process. So we will take your questions, concerns, questions that you have about this process.
Yep, and just a reminder, you can type those questions into the question box that's on the right side of your screen. You should see there.
So one question that we did get throughout as we were talking about the team, one community is noting that they're ready to take some of these next steps, but they're not sure that they have that team of 4 to 5 people that can commit to participating in a team, and so they're wondering what their options are.
Yep. So this is Kate. And the coaching program, the Roadmaps to Health coaching program for teams, we really are encouraging, and we'd like to be able to build community capacity with a larger team, with 4 to 5 individuals representing that already existing partnership. But as Karen mentioned, that is not the only coaching that we have available for our communities. And so we really encourage you to contact us directly, discuss what's going on in your community with us. We may still encourage you to apply, or we may find a different opportunity that would fit better with your needs. So if you're in that boat where you think, hey, we've got some good stuff going on, we could use some help, but we don't really have 4 to 5 people, then contact one of the community coaches, Karen or Jan or myself, and we can walk you through what we think would make the most sense based on your community's needs.
So Megan is asking whether we have any recommendations for what types of projects would work best for the coaching process. And this is a great question. I think it's really, and I'm going to have Kate chime in as well, but I think that it really depends on what is most important to your community. So as we noted, the more specific that we can be, the better. But as long as you're toward that left side of the take action cycle, you maybe selected a policy or program or in the process of selecting a policy or program that you want to be working towards implementing, or maybe you're trying to set up an evaluation plan, communication plan, things like that. Those are all, whatever type of project you're working on within that area of the take action cycle would be a good fit for our coaching program.
Yeah, and I don't know that we'd say there's a best type of project. I think, again, we want to make sure that what you're doing makes sense for your community and that it's doing the work that is meaningful and will have the most success in improving health in your community.
We've got a handful of great questions here about what types of communities can apply, how big the geography may be. Does it have to be a county? Could it be a city, a smaller community? We work with communities of varying sizes, so I think if whatever community means to you, that works for us.
Yep. Despite the fact that we are called County Health Rankings and Roadmaps, we know that not every community makes sense as a county, and so we work with cities, we work with multi-county regions, we work with parts of counties. So again, we really are thinking about this as the community that you've defined that you are working to do, that your partnership is working to improve health in. So however that makes the most sense for you. We have a question about the availability for on-site consultation. So again, the team coaching program that we're talking about today that requires this application process will include about 8 60 to 90-minute phone calls, and then the option for an on-site consultation. And that would just be discussed with the community as to what makes sense. So it's not something, if it doesn't make sense for your community, it is more work than you think you'd get value out of. But that is an option for communities that would be accepted into the team coaching program. Right, lots of questions coming in now.
We also had a question about how rigorous the needs assessment requirement is. And what we are hoping is that a community has looked at some data and has an understanding based on both a little bit of quantitative, or at least some quantitative data and some qualitative data, what their needs are in their community, and that they have good reason for why they've selected the priorities that they're working on. So I don't think we're going to be getting into a deep questions about what you did specifically in your assessment, but we want to understand that you've done some sort of an assessment to understand the needs in your community.
Yeah, we just need to know that you selected priorities based on some sound reasoning. And again, those look different in different communities depending on what size geographically the community is and what data is, quite frankly, available to them. But so just let us know how you came to the conclusion that this is in fact a priority in your community. So we have a question about kind of team membership. So there's an academic institution working closely with a community partnering on improving health outcomes, but the university is not in the same county as the potential community would be. Again, so we're asking communities to send a diverse representation of their partnership. So we know that if a county or a community is including the academic staff, maybe to help with evaluation or other things, I think that certainly would be acceptable. It's just letting us know, again, in that team roster, what each of the team members brings to the team, sort of why you want to participate in this program as a member of or representative of your partnership. So certainly, I think that each community partnership can decide who makes the most sense to send as part of their, or to have as part of their team.
So we also have a question about, again, kind of that assessment process, and I think this question is particularly interesting because we know that communities, we have our Take Action cycle and it looks very neat, but that people really are kind of in different places in the cycle all at one time. So Sharon is asking if a community has done an assessment and come up with a priority, but they're still in the process of prioritizing their action, would that group potentially be eligible? And I would encourage you to put together an application. If you are moving toward action, you're ready to either select a policy or a program, or you have maybe selected a couple of policies or programs that you're trying to choose between, I think that would be worth putting together an application. So we're just kind of taking a peek at, we have lots of questions coming in, so we're just going to look through some of these and see.
All right, so it's some more on the implementation pieces. So if you've they've already begun implementing our program, and that's fine. Again, so if you're anywhere really on what we're calling the left side of the wheel, so if you've done your assessment and you've selected priorities, you may have already selected some strategies and begun implementation. You may still be thinking about what strategies you're going to select to address your selected priorities. You may be in the middle of implementation, stuck on evaluation. So we're going to work with communities anywhere on that side of the wheel, because we know that just because you've started implementation, that doesn't mean the hard work's over, and that there's still certainly a lot of work to be done. So absolutely, if you've already started implementation, that doesn't disqualify you. We would, if you feel like this would be a valuable resource to you, would love to see an application from you.
So we have a question, again, about that team makeup. And this is a community-wide coalition. But there's also a group, an interdepartmental city team that has been working on some specific projects in response to that community-wide, their community-wide needs assessment, and in partnership with that community-wide coalition. And Mary is wondering whether they can use that interdepartmental group as their team, or would they want to recruit from a broader coalition. And I think, you know, again, you can do what makes most sense for your community, but it would be really great to see broader representation on a team that gets outside of just one organization, just outside of one sector, so that we can really build the capacity of as much of that larger coalition as possible. Great questions.
And Angela, hopefully that answers your question, that if team members have to work in the same place. And the answer is we would prefer that they not. We really do, again, want team members to bring different perspectives. If you look again at that Take Action cycle, there's all of the blue circles that have different sectors represented. You know, and certainly you can have people that aren't represented in those sectors as well, but we'd like for you to have as much diversity as possible on that team. And we know that that's sometimes limited based on, again, community size and resources available, but again, in your application, let us know who's on the team and why you think that this is a good representation for your community.
Kenya has a great question that I think a lot of communities will probably be wondering about. They've just developed their community health improvement plan, and they've selected 4 priorities. A lot of communities select, you know, anywhere from 3 to 5 priorities. She's wondering if they have to pick just one. And what we would like to do is work with a community on one of their priority areas. So if we can be as narrowly focused in our coaching work with the community as possible, that's helpful. It allows us to be really specific and really action-oriented on that one particular priority area. And hopefully what comes out of that will be what you learn, the capacity that is built there will then be applicable to those other priority areas.
Kathy has a question about, will communities that are selected for the opportunity have an opportunity to interact or learn from one another? I think that will depend. One of the things that we always strive to do as coaches is to connect communities with other communities doing similar work or having similar challenges. We do get that learning from other communities that are in the same spot as you, having the same challenges, can often be the most meaningful and powerful learning that can happen. And so I think, as coaches, we're always talking with each other about the communities that we're working with in terms of what's going on and what communities are doing, and so that we're aware of what's happening in other communities around the country. So where it makes sense and where possible, I think we would like to be able to do that. I don't know that there's formal plans for that in this first part of the coaching, but I think that things will evolve, and I think, again, if that makes sense, we will do our best to make that happen.
Yeah. Kelly is wondering what guidelines that we will be using to determine which applications to award. This is a great question. I'm going to move back to the slides about the partnership and the team. So the things that we mentioned here about the partnership, what we're looking for in a partnership, and then I'll move in just a moment to the slide about the team. Those are the key things that we're really looking for. We're really looking for, again, partnerships that have active community engagement, including with members from vulnerable populations, partnerships that have conducted some kind of a health assessment, that have set their goals and priorities with their community members, and that they've used data and evidence to decide where they're going to, what their plan of action is going to be, what they're going to work on. And then in terms of the team, again, we're looking for members who are diverse, that represent the breadth of the partnership, and we're looking for teams to articulate and help us understand how participating in the coaching program will impact their ability to improve community health. Kate, is there anything you want to add about what we're going to be judging these on or deciding on?
Yeah, I mean, I think those are this is, again, the big points that we wanted to make sure we highlighted in this webinar. And it's communities that are ready to take action, that have an existing partnership. So we also have a question here. Can we attach our assessment report and ship? The answer to that is no. I know that's a tempting proposition, but we would, there's an opportunity to just give us a brief summary of what you did in that assessment with the chip. Again, we aren't going to judge. It's not a really rigorous. We want to know that you use good, sound judgment, that you use some data, that you collected information from your community, that you talked to people in your community, and hopefully the people that were most impacted by the issues that you're looking at. So tell us how you identified the problem that you're working on, what that process was. But we, in part for the sake of reviewers, looking at that many, assessments and chips, we know some of them can be quite lengthy. If you can give us the sort of Cliff Notes version of what you did and let us know how you came up with your priorities, that's what we're looking for.
We have a question about what to expect from the curricula of the coaches program, and if this is going to be more tailored. And the answer is yes. We are hoping to work with communities and these teams to really tailor the coaching materials, the coaching questions, the work that we're going to be doing with the community toward your specific community needs. Thinking about the content of that, again, going back to our Take Action cycle, and thinking about information, tools, guidance that might fall under work together, communicate, choose effective policies and programs, act on what's important, evaluate actions. That's the type of material that we're really going to be focusing on. And we have a number of tools and guidance that we'll be falling back to and using, pulling from in our Roadmaps to Health Action Center.
We have a question about financial assistance, and is there any financial assistance for the coaching project? There is no funding that comes with this coaching project to the communities. However, the coaching is provided at no cost to the communities. Obviously, your time and energy is certainly a cost that we recognize, and a big one, but at no additional financial cost to the communities, and thanks to the Robert Wood Johnson Foundation. So there's no funding tied to it, but there is the assistance and the coaching that you will get is at no cost to your community.
One of our participants, Marla, is noting that in her organization they have a number of key partners that represent some really key organizations in their community, but she's not really sure that they represent vulnerable populations. And we understand that communities often are working toward this and struggling with it, and it's something that we will work with communities on. And so it's great. We want to see that when possible. If it's not happening in your community, please don't feel like you can't apply. But it's something that we understand that communities are working toward this and struggling with it, and it's something that we just want to emphasize as it's an important element for communities to consider.
Yet another question about is developing an evaluation plan for a particular project would be an acceptable outcome. Again, so you'll develop a coaching goal with the coach if you're accepted as a community, but evaluation is certainly part of that left side of the wheel in an area that we know a lot of counties and a lot of communities are struggling with. And so, yes, I mean, it may go beyond just an evaluation plan, depending on how complicated that is over a 9-month period. But again, so you'll set the specific goal if you're accepted, but evaluation is absolutely something that we would help and coach on. All right.
We will be capturing many of these questions into a frequently asked question type document that we'll include on our website in the next week or two. So if you are wondering, about responses, if this is going to be captured somewhere, we will have a document in the next week or two.
We have a question about, is this a first-time program, or can we look at past applicants? So this is the inaugural launch of the County Health Roadmaps coaching for teams. We have been, as coaches, we have been coaching communities since the launch of the County Health Roadmaps program in 2012. This is the first time we're really taking it to a more formal level and through an application process and really creating a very specific goal-oriented start and finish kind of coaching package. So there aren't past applicants to look at. So we don't have that for you, but again, we are really excited to be launching this program and look forward to the applications this year.
If you have any problems with the application process or questions during the application process, I'm going to please send those questions to match-info@match.wisc.edu. The 3 coaches will be watching those questions closely and be responsive to you within 24 to 48 hours. We want to thank you very much for your time today. This has been, it's really helpful for us to see your questions. And as I said, we will be working on a frequently asked question document, and you can also reach us at that email, match-info@match.wisc.edu, with any questions, additional questions about the coaching process and application. Thank you very much. Have a great afternoon.